Is excess skin removal such a thing for loose skin on neck? Was an avid marathon runner for years, and at 48, I have noticed that I have sagging skin under my chin. I was thinking that all I need is the excess skin to be removed, as I have tried several alternative treatments that have not produced the results wanted. What is the recovery time of this procedure? Can it be done in office?
Thank you for your question. You submitted a single photo of the neck area, and you're asking, is skin removal under the chin or the neck area something you can get done? And you state in your question that you are a marathon runner and that you're 48 years old, and that you have already tried some alternative methods for improving the neck area, which didn't seem to work out very well. And so you're asking about the downtime and what's involved in a procedure to help this area. Well, I can certainly give you my perspective from my experience as a practicing doctor. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I can tell you that solutions for aging face has certainly evolved over several decades and continues to evolve, and the procedures are often determined by the physician's personal experience and overall perspective. So certainly you will have no shortage of opinions as to what is optimal for you, but I can give you a little bit of information about what's been my experience, particularly with people like yourself who are in the elite endurance athletic level. And this includes marathon runners, ultra-marathon runners, people who do triathlons. And when you look at yourself and you focus in one area, you're looking at your neck. But I would probably be accurate to say that it's a good chance that also, if you look at your own face, that you probably have a significant amount of facial volume loss. It's been my observation that people who do these endurance athletics have virtually almost no perceptible body fat. And unfortunately, that also leads to volume loss in the face in a more global way. Now, the challenge in your situation is what can be done optimally to restore better neck definition, which is one element that I think is significant. And I can tell you that the traditional approach would be to do some type of face and neck lifting operation. Basically, whatever variation you can think of, there are ways to do that, and you can go from anything from a small incision face and neck lift, or a small incision neck lift, or more extended neck lift. But one of the things that I feel like has given me a little bit more of a perspective on what is the optimal solution for patients like yourself is to also focus on the overall, the greater picture. The point is that when you have significant volume loss in the face, and even if you don't feel like the face is an area that you're concerned about, you just want to solve the neck, we have to think about this system as being continuous. And so when you lose facial volume, the skin sags and the tissue sags downward. So if you think about it a little bit more, you can understand part of the reasons why the alternative treatments that you tried didn't work. I suspect you may have had some type of a thermal energy device that tried to shrink the skin. You may have tried other options which were maybe less invasive. But when you think about, let's say you're lifting a face or a neck, then if there's less volume, then you're trying to really wrap the skin in a way when you have a smaller overall shape. So there's somewhat of a mismatch there. Now, the point of me telling you this is that I would say that when you do a consultation with a specialist, one of the things that I'll tell you what my first thought is when I look at someone's face, I look at their volume loss first. And very often I find that for patients like yourself, structural volumizing, this is a technique that we do in our practice where we use fillers, and fillers that are traditionally well known, such as Juvederm Ultra Plus or Juvederm Voluma, long-lasting fillers that are placed at the level where there's the most volume loss. And although fat certainly is significant in terms of the overall facial volume loss, you have to also think of bone loss. Now, when you think of bone loss, you're most likely thinking more of genetics. However, there may be some degree, depending on the level of stress your body goes through in the sports you do, that could possibly have an effect on this as well. But that's not my specific area of focus. Basically, what I think about is really how much can we really restore. When people who have very thin faces and have volume loss think of fillers, they're often afraid because they're afraid that they're going to end up looking kind of doughy and strange because their faces are so thin. And certainly that's a reasonable concern. And also they feel like there's almost endless how much volume that can be potentially placed. With structural volumizing, what we're doing is we're placing the material, the injectable filler, at the level of the bone, between the bone and the muscle. So it actually restores a lot of volume that makes the face look more balanced, and it has, depending on the amount of volume you place, a somewhat lifting effect, because by restoring volume, the skin kind of comes up a little bit. Now, that's not going to be the only solution in your situations. I think, even though I don't have a view of the full face, I don't think it's going to be the only solution, but it's worth considering and understanding in your strategy. There's a good chance that the amount of skin under your chin may require some degree of face lifting, some degree of neck lifting, and that's basically requires an examination. When I'm doing an evaluation, I lift the face a little bit to show the patient how much of the skin comes up, and I then pull behind the neck, right behind the ear, to show how much the neck will come up. Now, even with that, there is often a certain residual amount of skin, and that becomes kind of tricky, and unfortunately that's just the reality. Sometimes the geometry is not always perfect and favorable, but as long as the goal is improvement and maximizing improvement, then you can then, or I should say, once you restore structure, whether structural volumizing and lifting, then you can do refinement. I think that one of the great limitations of a thermal energy device, and regardless of whether it's focused ultrasound or whether it's radio frequency or whether it is laser, the shrink wrapping effect of the skin with these less invasive procedures can only go so far, and usually it's not close to enough. So I think that when you can just take this concept and keep it in mind when you're doing consultations. So understand, not just thinking about what's the best lift for you, but think of also the global cause of this aging appearance that could be contributing, and then strategically you can consider structural volumizing. Like without looking at your face, I would say that I would probably do something like structural volumizing and combine it with a conservative face and neck lifting procedure, something done under local anesthesia with light sedation, and so that there's a quicker recovery and people go back to work in about a week. So learn more about these ideas and meet with qualified, experienced cosmetic surgeons, and hopefully you'll get to where you want to be. I hope that was helpful. I wish you the best of luck. Thank you for your question.